Okay. Okay, so I will just do the intro in Arabic, sorry, and then we will start.
Sure.
Okay, let's go. Okay. مرحبا فيكم متابعينا. اليوم عندنا حلقة جديدة، لقاء عن مرض السرطان وطرق طبيعية للتخلص والتشافي. هذا اللقاء بيكون باللغة الإنجليزية، ولكن بتشوفون في ترجمة عربية في أسفل الحلقة. وأتمنى أن تحطون تعليقاتكم أيضا بالأسئلة، أي أسئلة تخطر ببالكم حطوا لنا تعليقاتكم. اليوم حوارنا عن الطب الهندي العريق جدا وكيف له علاقة في تشافي مرض السرطان. Thank you very much for coming on the show, Dr. Satish. I would like today to introduce the Ayurvedic view of cancer healing. I know these days natural cancer healing has become a little bit controversial, let's say, but I always want to give my viewers options and chances to look at other views. And I wanted to just discuss in general with you. I have not had this discussion with you before, so we are having it for the first time as well, me and you. But of course, I know you very well from Shraya's, and I see you every year when we come on the India trip in Bangalore to Shraya's retreat, and you are one of the doctors there. And I know that you have several cases of, let's say, quote unquote, difficult illnesses that are deemed difficult by modern medicine, but Ayurveda seems to be treating them happily. So let's start with the topic of cancer, and I'll ask you a question that I asked you just now off air. Do you, as an Ayurvedic doctor, actually deal with cancer patients at the moment?
Yes, we are dealing with a lot of cancer patients. Not only even including the chemotherapy side effect, the radiation side effect, even some people who not able to go for a second round chemo, third round chemo, they will come to us. They will take treatment and they'll get ready for the chemo cycles. Also, they go, and we are in a position to manage cancer patient and also the complications of radiation therapy as well as chemotherapy.
Okay, so I'm just trying to put myself in the shoes of somebody who is either looking for solutions for cancer or maybe looking for solutions for their loved ones. Sometimes what I hear from an alternative perspective, I hear that the modern medicine doctor is not open to their patient working with any other modality, let's say. Do you find that in India, doctors are a bit more open with their patients working alternatively, or is it even considered alternative Ayurveda in India?
See, in India, definitely it is on the larger scale, it is considered to be a alternative medication still. But there are people who the oncologists are associated with us, and there are people like in Hyderabad, Omega Hospital in Bangalore, certain oncologists they are associated with us. They cross refer to me few patients with a complication. For example, blood cancer patient, when they are on the chemo cycles and all those things, even management of certain things become difficult, they refer to us. So there are oncologists and oncosurgeon in India, they are open to the Ayurveda view and they refer the patient to us.
And do you find that, is it easier for you in terms of success rates with Ayurveda? Is it easier when the patient comes to you before the chemo or when they've already done the chemo and come to you as a complementary therapy, or even after chemo has given up or after modern medicine has told them that there is nothing else they can do? Is there a difference at what stage they come to you as an Ayurvedic doctor?
Okay. Taking that question, I need to answer in a three section. I need to split it three. The first thing, yes, nowadays, if you ask me about 6 to 7 years back, that the primary stage, somebody reaching Ayurveda doctor was a very rare case. Very rarely approach in the first stage. But nowadays, there are people directly looking for Ayurveda management. They come to us at the very, very primary stage. And in certain varieties of cancer, in a first primary stage, really the prognosis is really good. Means we can treat them very well without much of any other support. I won't say every stage of cancer we can tackle that way. Certain varieties of cancer, like acute myeloid leukemia. These things are very well managed. The prostate cancer in the first stage and the urinary bladder, the first stage cancer managed very well with the Ayurveda. So when it comes to by and large, the many people comes as along with the chemotherapy and radiation therapy, they come for a more than already we are under the treatment. We don't want again cancer to reoccur. For the preventive model, they approach us. That is the last group is, as you rightly said, okay, they done everything. Now there is no hope. Now there is no other thing. So they don't want to sit quietly. They want to do something. Then other group also come. The initial days, I would say that was the larger group who is to approach. Now everyone left us. Can you do something? That was the larger group. Now the days are changing. Actually we have now the flow is really good. Now most of the, if you ask me percentage wise, the mid range, like already we are in the chemo and radiation. Now we are looking for we are having some difficulties. Even they are not hopeful. Can you do something for us? That group is major now.
Yeah. Okay, let's start with the group that is already doing chemo and radiotherapy, and they are seeing the side effects of that. How would Ayurveda help them? Are we talking about oils externally? Are we talking about medications and herbs internally? Just like put me through a remedy for a patient who's going through that, because chemotherapy can be very intense on some people.
Yes. See, now presently one person with a esophagus cancer, the person approached, he already for the first cycle of the chemo. In the first cycle, it consists of the 7 session of chemo. Okay. He underwent 2 chemo cycles. He underwent 2 chemo sessions. So he became extremely tired. He developed a lot of itching all over body. Then he developed a severe dry cough. His appetite gone completely shrunken. His hemoglobin dropped like anything. Hemoglobin which hit to the bottom of 6. Then there is a exertional dyspnea. So then dry cough is so persistent, he is unable to sleep. Then there is a lot of inflammatory changes in the body, the tenderness, swelling, not generalized swelling, the scattered swelling here and there, it is there. With these many complications, he came. So what we did is we given a medication, except dry cough, everything disappeared. Dry cough percentage reduced by 80% within the 10 days. Then hemoglobin within 15 days, which improved to 8. Now exertional dyspnea is not there. He's eating. So now after they were planned after the 1 week 3rd session of chemo. But because of his health condition, even oncologist denied, we can't do, your general condition is not good. Then his the everyday evening, the temperature of 100 to 101, which was persisting, whatever they done, the fever was not coming down. With a single dose of Ayurveda medication, the fever went away on the day first itself. Then remaining thing, within a week, he was all right. Now dry cough, after the 21 days, the 95% is resolved. He is eating it all. Now already he finished another 2 sessions of chemo. So this is,
Yeah, go ahead.
So what we did is, when we need to manage, in this kind of a condition, we take symptomology into major consideration. What are the kind of a side effect it is happening, we need to consider. And the modality of treatment will include external treatment, like, the herbal decoction bath or oil application, or the majorly without internal medication, which is very difficult to manage. The internal medication will be a part and parcel of management when we do the chemo side effect or radiation side effect.
And the internal medication is what? It's a combination of oils and herbs, or what is it exactly?
The combination of, there are 2 choices. One is if the person is ready for the herbo-mineral product, which is the mineral component, the results will be quite good. And means the medicine preparation, if it is good, there is no side effect. Even we have the pre and post, both the reports, which is really wonderful. The herbal medication also there, both herbal combination and herbo-mineral combination, mineral combination. In this gentleman, we used mineral combination of one component with one single dose. His fever has been reduced completely. Till the date, no fever at all.
Mm. So just so I can understand, because I know there's a lot of therapists and doctors and healers that could follow this episode as well. When you say that they heal with minerals, does that mean their cancer was a mineral deficiency, or does that mean that you are addressing the imbalance happening in their dosha based on their symptoms? I know with Ayurveda, there's body types and doshas, and you look at that. So just take me through the thinking. I just want the logic behind it, you know?
See, when we gave the mineral component, it is not to treat the deficiency or anything. It is those minerals are potent to manage the root cause. For example, in his the gentleman who had esophagus cancer, when he had a chemotherapy, in according to the Ayurveda, post chemotherapy, when he developed a fever, it is according to the assessment, it was the imbalance in the pitta and particularly vata. To balance it and his inflammatory condition, in Ayurveda we say it is shofa. It is again the predominance of pitta. To manage the pitta, pertaining the which balances the pitta or which reduces the pitta, that particular herb mineral product we gave, and which balanced the pitta, automatically fever went away.
Okay, so let's just explain a little bit about pitta. You mentioned it a few times. That is the fire element in the constitution of the person, correct?
Yes, exactly. The pitta is the main component is fire. Secondary component is along with that is water. The pitta is the combination of fire and water combination.
Just to give a little bit of background, the Ayurvedic medicine looks at each person as combinations of elements and which elements are higher than others, correct?
Yes, absolutely. When we assess the person, we need to assess the person constitution, which constitution he belongs. Like he is a Pitta Kapha predominant or Pitta Vata predominant. That is a Prakriti assessment. That is a constitution. And also what is person is suffering. What are the different imbalances is there in the body, that also need to be assessed. Then correlate what is his constitution and what is his imbalance. Both you need to correlate together, then you need to treat it.
Okay, so let's just go through them just so I understand as well. So the pitta is a combination, the pitta body type is a combination of fire and water, correct?
Yes.
And
correct.
the
Absolutely.
vata is air and
Ether.
Okay. Space.
Yeah.
Okay. And the kapha is water and earth. Is that correct?
Earth and water.
Earth and water. So more earth and then a little bit of water. So based on that, if you analyze people, their doshas, and you see what body type they're born with, correct? It is something they're born with. They don't develop over time. They are either pitta or they're not. They cannot become pitta over time, correct?
See, that percentage wise in Ayurveda, they say it is up to 70% you inherit from your parents.
Okay.
Inherits from the parents. Remaining thing, the way person live in, what kind of a nourishment means, what is a lifestyle and what is a food habits. According to that, these factors are also responsible to form somebody's prakriti. By the age of, once the person is attained puberty, by finishing the puberty, the constitution is formed with the genetical factors and environmental factor and the food habits together and lifestyle together, the constitution is formed.
So based on that, do you then see specific cancers in specific people? Like if I don't know, a specific cancer has the tendency to increase inflammation, etc., is it more predominant in pitta kind of doshas?
Yes, if the person is the more predominance of pitta and vata combination, and if their lifestyle is towards that, definitely yes. Where the inflammatory, somebody is more prone to inflammation condition and all those things, yes. Even we have evidences for that. Somebody is having the intestinal PS patches continuous, who is undergoing continuous inflammation and all those things. The beautiful example is Crohn's disease, ulcerative colitis, over a period of time, which turned to be a cancerous. The 2-3 years back, CA markers are negative. Then a whole lot of after the 3 to 4 years, in many people it turned out to be a cancerous. Even Ayurveda clearly tells when there is an inflammation, you need to tackle and you need to treat as early as possible.
Yeah. So then that means you can work with prevention. Then that means you can tell somebody if you are Pitta, you have to work on XY because you have a bigger tendency towards digestive problems, for example, or digestive cancers even.
I don't want to really commit to the word of the digestive cancer, but definitely digestive issues, yes. In Ayurveda, it is very clearly mentioned, the predominance of Pitta person, they are always prone to their liver, particularly the stomach, then the eye, then the brain. These are the target organs. They can really get the problems related to these organs.
Hmm. So what does the fire element in Pitta have to do with the eyes?
Because even particularly the Pitta, again, particularly divided into 5 different the different Pitta, like Brajaka Pitta, Alochaka Pitta, Sadhaka Pitta, like that. There are 5 different. So one particularly the Pitta variety sits in the eye and which governs the eye function and all those things. So when there is an imbalance, again there is and above the organs of above the clavicle organ, the Pitta which is sitting, which is very sensitive with the influence of Vata, which can really get deteriorated quickly. That is the reason the Pitta people are eyes are sensitive, but.
So the Pitta people have more digestive tendencies and brain issues and eye issues. What would be a Vata predominant dosha tendencies, let's say, or illnesses that they could fall under?
Okay, Vata people, their digestion is not stable. Whereas Pitta people, the digestion is very fast. They eat quickly, means their digestion rate is quick. They eliminate quick. But whereas Vata Prakriti people will always have fluctuation. One day they may have a good digestion, one day they have a bad digestion. Means it is not everything get fluctuate. Similarly, their physical strength is not really good. Means they're physically weak. Their exertional capacities are poor. They are more prone towards the musculoskeletal issues. Then they are more prone to get into the neuromuscular disorders. Then their degenerative diseases are very quick.
Okay, interesting.
So the Vata people they are more prone to this kind of issues.
And then the last, the earth and water, the kapha.
Yeah, the kapha. The kapha people are more, their metabolic rate is quite slow. Means they are sluggish digestion people. Very sluggish digestion. You give them a good morning breakfast. The lunch, if you're not providing, also they're okay. Means their digestion rate is very flat and all those things. They're built with a good musculature and all those things. They're more prone to weight gain, metabolic syndromes. The metabolic syndrome, like the thyroid issues, the diabetic issues, they are more prone towards the get into the metabolic syndromes. Apart from that, their sleep apnea, they are more prone. All the obesity people, all the obesity disorders are they more prone to the kapha people. And means majorly they quickly gain the weight. Whereas Vata people, they struggle to gain the weight. Pitta people, they eat, but they digest well. Even they struggle to the weight, but they are moderate. Their build is moderate. Their appetite, their hunger level is very high, but they can't eat more. With a limited quantity of food, they are fine. That way it is. They are not voracious eaters.
So do you see that there's specific cancers which Ayurveda has succeeded in more than others?
Yes, the leukemia, the blood cancer varieties, especially the acute myeloid leukemia success rate is quite good. The prostate cancer and the scattered, the invisible bladder cancers also, there is a quite good result.
Okay. And even if they come in late stage?
once the acute myeloid leukemia in the first time it is the good. Once it is the acute myeloid leukemia, blast cells and everything became absolutely normal. And again, once the relapse comes, it is very difficult.
Yes, yes. So is it possible that when I'm trying to put myself in the shoes of an Ayurvedic doctor, when you see a cancer patient, is it possible that you have two cancer patients with the same type of cancer, but you give them different treatments because they present with different symptoms?
By and large, yes, based on their symptomology. See, although the well-established diagnoses are there on your table, but still we try to understand we ask a lot of questions to understand the symptomology. Based on that, some of the medicines choice will vary based on their symptomology, because there will be a changes in the dosha predominance. This vata, pitta, kapha, that permutation combination will vary. And that is the one thing. Second thing is, again, Prakriti. If the two individual belongs to the two different Prakriti, definitely the choice of medicine will vary.
Yeah. And Prakriti, how does that differ from dosha? Because dosha is the body type.
Dosha is dosha itself decides the body type, but there will be a different combination. When these doshas are in the balanced state, it forms the body. Again, when these get imbalanced, it also causes the disease part also. So without the vata, pitta, kapha, nothing is there in the body. But in a balanced state, it does the construction work. In the imbalanced state, it also means spoils, or it brings the disease state. So it is having a lot of different functionality. It is not only the body type, it is also does the imbalances, giving a lot of different health issues and all those things.
That's dosha, but what's Prakriti?
The Prakriti is formed by the doshas. Combination of dosha will decide.
Okay. Okay.
For example, if vata pitta is there with a different permutation and combination, somebody's Prakriti will form. Then that particular person we call he is or she is pitta vata, kapha pitta, like that.
Yeah. And is everybody a combination, or can somebody be purely pitta?
Yes, we get very few. In the last my 18 years of experience, hardly one or two people I saw with a very predominant only one dosha. But by and large, you get two combinations are quite common.
Yeah, and the first one is the dominant one. Like the one you say he's pitta kapha, that means his dominant.
Exactly. It depends upon the mark sheet. You need to how many qualities they possess from this, how many qualities from this. Then we need to combine. Then we need to calculate, and we need to come to a conclusion.
So I have a question about historically, before modern medicine, because Ayurveda is much older than modern medicine, I assume that cancers were dealt with directly by Ayurveda. In today's world, when somebody comes to you and you suspect cancer, do you opt for working with an oncologist, for example, and say, no, go and do your test, get diagnosed, and then come back to me? Or is Ayurveda still that complete system where you can actually diagnose and treat? How closely do you work with oncologists, basically, is my question.
So, yeah, in my particular case, rather than talking about in general, particularly me, so when there are many people who comes with just symptomology, at the clinical level, in my own clinical level, I diagnose cancer with I take a help directly from the modern engineering, means let's say the scanning, the blood test, then the PET scan, all those things. When once I'm going to establish the diagnosis and all those things, then many times I don't want to take a risk. I will ask, see, this is a very clear cut this thing. What is your choice? Because the person, we need to give them option whether he want to go with Ayurveda, what is the success rate. I will explain. Then better you go and meet an oncologist and take an opinion. Then come back to me. What you want to do, you decide. So that is, then many people they give me option. No, we don't have a clue. So you tell what is best. Then I'll give them. So in that way, in my circle, whoever oncologists or oncosurgeons are there, definitely I take a help. For example, I cannot operate. I'm not a person with a
Yes.
surgical this thing. Where even in Ayurveda, it is very clear. Where there is a cancer cells are there, it needs to be removed. Even in Ayurveda, there is a surgical surgery is also recommended. We need to remove that particular affected part. Definitely, as of now, we don't have a facility of those things. So I refer to the oncosurgeons to remove. For example, breast cancer. I'll ask them, go and remove the tumor and come back. The papilloma carcinoma, the ductal carcinoma. So if you remove the particular part which is causing a issue, so there definitely we take help from the oncosurgeons and all.
Mm.
So and vice versa, there are certain conditions after the 3 or 4 sessions of the chemo when there is no, they feel there is no good prognosis. There are within my team oncologist and oncosurgeon, they refer to me. See the the what we expected, we are not getting a result. You would like to add on.
Mm.
So those things.
So when I have many episodes where I've spoken to alternative oncologists in different schools. So they
Okay.
believe in different things. So some of them believe in low dose chemo while they're doing the alternative remedy. Have you ever had to resort to that, like a milder injection of chemo or milder treatment of chemo while you're doing your work? Does that help you? Do you prefer not to do it?
See, the most of the times what happen when they come to me, already they are on the chemo cycle. Already they finished 2 or 3 cycles and all those things.
Yeah.
So what happen? I will understand what kind of a chemo they are undergoing and all those things. According to that, I complement with my own treatment. Very few people, oh, maybe only 1 or 2% of the people they come to directly to deal with that. So if it is a first stage, even I not even taken any help from the chemo or anything. If it is the surgical oncology, I will send it to them. Then they will be on my own medication directly. But that percentage is very low. I can't give the number of patients too many on that.
Mm.
So the the prostate cancer, which is spread to the bone, everything with a very low dose of chemo because they were unable to afford for the good chemo. So the very low dose of chemo, and with my medicine within the 4.5 month of time, the 95% of the tumor cells were gone away. Metastasis came under the control, and his lifespan was being given only 40 to 45 days. So he's still alive. He's doing very well, and after the 3 years, the cancer got again relapsed in the vertebral column. But the pain aches are there, but we are managing. So that way it works.
But it's relapsed. I don't know if
Because the reason is also because after the 2 years, they said no, anyway, no, now there is no cancer cells or anything. Everything is under control. Why should we continue the medicine?
they
That
stopped. Okay.
is
Okay. So
after the
when you say 3 to 4 months of treatment, does that mean that the person is with you at the center, or does that mean they do it at
no.
home, or what does it entail?
Yeah, so they will be taking medicine sitting at home with their day-to-day life
They're
activities.
just drinking your medicine
Yes.
without oils, without external oils or massages or anything.
No massage or anything. It is only the internal treatment, and
Yeah.
we will maybe local pains for the local pains and aches. We may advise them to apply some herbal paste application or oil application. It is at home, not in the hospital continuously 3.5 months. No.
Yes.
So sitting at home doing their activities, they will be taking medicine.
So they chose to stop it because they thought it wasn't coming back.
Yeah, because the consecutive the 3 PET scans were showed nil activity, only one small tumor area in the bladder area which is there, and FDG uptake was not there. Then they were happy. So then maybe financial matter comes to their head, because normally I tell them whether it is in a good control or not in a good control, the minimum they need to continuous once everything is under control, better to continue medication for 3 to 4 years. We keep telling them, but still, after that, I think 1 year, 7 months or 8 months, they completely stop the medicines.
Yes. So how do you, as from as a nutritionist, I keep thinking that I just find it fascinating, the different schools of thought and different approaches to cancer. In my head, maybe there's a vitamin C deficiency, maybe there's a whatever mineral deficiencies. So do you look at their diet at all, or do you feel that these herbal concoctions and medicines that you give heal the problem so that even if there's a deficiency, it still doesn't produce cancer? Just take me through that thought. Like in my head, there must be like an immune deficiency, maybe there's low vitamins or something from our approach, you know? So how is it that just a medicine, if you say goes to the cause of it, is the cause not also dietary?
Okay, so the first part I will answer the how Ayurveda considers the Ayurveda.
Yeah.
It is we have the fundamentally there are different stages of one disease to occur. There are 6 different stages we study. In that there is a particularly there is a way which is called as ati pravritti, means excessive. Means in any tissue which grows in excess. That is
Excess.
very
Yes.
yes, which is explained in Ayurveda. And again, there, what are the combinations will be there? It is Vata and Pitta is the more predominant dosha when one particular thing to grow excessively.
Mm-hmm.
So that is called as Ati Pravritti. So that Ati Pravritti is because of Vata and Pitta dosha. Even it is in Arbuda chapter, what I told in Ayurveda, it is most of the times cancer particular things are explained under the head of Arbuda.
Excess. Yes.
Excess. So that excessive, so again, you can consider like a cell proliferation and all those things. So it is nothing but ati pravritti for me. So there again, what are the fundamental dietary aspect? What are the food which causes I need to restrict for the disease management?
So what would cause excess food?
Yeah, means growth. So the excessive the provocation for the cells to grow excessive, we need to cut down those food product. That is for the disease management. And also when I'm treating any case in Ayurveda, without appropriate diet, nothing can be done. Ahara is the medicine. In all the books of Ayurveda, by and large, ahara is considered to be a medicine. One should consume food like a medicine. How you are
Yes.
everything means step by step, how precautiously you eat medicine. Similarly, one been explained that important in Ayurveda. So 2 angles are there for a particularly any disease management, not only the cancer. One is you need to consider what are the causative factor for the cancer you need to avoid. Also, what kind of a medication you are giving. To complement that, you need to also look into the diet. With certain medicine, when we advise, we need to avoid certain things for the better bioavailability of the medicine. So that way, both the angle we need to be looking at management of any diseases.
Yeah. So when you said excess, I was thinking of fasting just to reduce the excess of everything. Like even excess eating can cause disease, excess drinking, excess everything. So is fasting part of the Ayurvedic approach for cancer or not?
In a few varieties of cancer, definitely yes. For example, the blood cancer varieties, which is very rare kind of a topic, but many people are aware of it in Ayurveda fraternity. The blood cancer explanation, which we get into the chapters of Jora, means the fever, where our books explains about fever. There are particular fundamental different varieties of fever are there. In that particular chapters, few fever qualities exactly goes with the blood cancer sign and symptomology, and we given medication and we got wonderful result. So in treating those conditions, definitely fasting therapy works. Fasting therapy works.
Yeah, but what's the fasting therapy in Ayurveda? Are we talking about like 24-hour fast or water fast? What kind of fasting is it?
No, in Ayurveda, the fasting chapter is quite a big chapter. There are for some people we provide only the medicated water and we keep them in a hunger state till they feel hunger.
Okay.
will be consuming medicated water throughout the day. For example, when the severely rheumatoid arthritis people comes with a severe inflammation and joint swelling and all those things, we don't even give anything to eat. Just we put them on a medicated water and inflammation will reduce within 24 to 48 hours. So there are people, we provide them a very, very limited food, like, the small portion of porridge and keep them on a medicated water. So like this, there are very different, the fasting therapies are explained. There are, for some people, it's only the medicated decoctions and sunbath. Even sunbathing is also considered to be a fasting therapy.
Sunbathing
So,
is a fasting therapy?
yes.
So it's like
that,
you're eating from the sun, like you're being nourished by the sun.
yes. So like that, there are majorly 10 different varieties of different techniques of fasting is being explained in Ayurveda.
Okay, very nice, very nice. So I have a question about when you said that, for example, breast cancer, as you know, it's a very common type of cancer. And you said that you prefer to refer them to the surgeon to remove the cancerous cells, and then you treat them.
Yeah.
What I would have thought that once you treat them, the tumor already starts to shrink. So why do you prefer to remove it than shrink it?
Yeah, so because in a basic principle in Ayurveda also it is said that the affected cells need to be removed, then there is no chances of relapse. It is a basic thing which is told. In Ayurveda, that is considered to be Arbuda. The name of that particular disease, cancer, we study under Arbuda. So anything which is excessively growth and which is infected or inflamed, for a better management, you remove it. So then there is no chances of spread. It is very well established.
And do you remove the tumor only, or do you prefer like a mastectomy or a hysterectomy when it comes to these things?
So to be frank, so that particular surrounding, what in basic principles also it said, it is you need to remove the whole area which is entirely affected. So again, which goes to the
The whole
mastectomy
thing,
and
yes.
radical mastectomy or all those things.
Yeah, yeah.
Because I cannot quote the proper example because it has not been done with any Ayurveda doctor as of now. The surgical oncology, which is not practiced by any Ayurveda fraternity.
Yes, yes, yes. But I mean, that could mean removing big parts of the body. Still, it wouldn't affect the healing process later then?
See, even those where with a post mastectomy and all those things, a few complications also we manage very well. For example, their wound healing rate is the surgical site healing is not good. Then there is a repeated oozing is there. Then we manage very well with those things.
Yes,
Even I
yes.
have those things. I have those kind of cases also where there was
Post-surgical.
a post-surgical complication with the wound management and all. We done it very beautifully.
Yeah. And you heal it with external oils or also internal?
Again, internal medication, external wound management, the cleaning methodology, then wound applications, and all those things. It is done in a very nice way.
What would you say are the downsides of Ayurvedic healing for cancer? Like, what do people complain about when they heal cancer with Ayurveda? Would they complain about the time frame? Because I imagine it needs longer than other medications. What would be just the downsides?
The downside is the first of all the taste of the medication. The taste of you need to take a repetitive dosages. The third thing is diet. The dietary aspect becomes bit strict to manage certain things. One is like this, and another the bigger means the area is the cost factor, because when it comes to the minerals and all those things, for example, we use a lot of the gold product and all those things now.
Gold?
Which is so in the nanoparticle format when we use
Ingested.
yes. So it becomes the costlier for the people to afford for it. So especially the lower middle class and all those things, they struggle. That is the one time where I noticed a lot of people drop the treatment protocols.
But yeah, but you're talking about chemotherapy, which is also very, very expensive. Like, how Is it
Yes,
relative?
I will.
It's much cheaper, I imagine, even if you're drinking gold, right?
Yeah, I will come to that point. What happened? They are already doing parallelly. Already they are invested there. So they, when it comes to here, they think three times. Already we are taking. Should we take parallelly or not? So that kind of these are the one category of downfall. And another the down part is the number of cases what we treated, which will be as of now, which will be very less in certain category of cancer. So the people confidence level is not really up to the mark to completely believe and come.
Yeah,
That may need, yeah, that may need a few years to develop the that
you need
number of
marketing.
and show it to the world. Yeah.
Yeah, Ayurveda needs marketing. So
Yeah.
I'm curious about when you say gold, when you say minerals in the medical concoctions, just explain to me what form the gold goes in, and what other minerals do you use other than gold?
In the management of cancer, normally we use the gold, silver, then the arsenic disulfide, arsenic trisulfide. Basically, these are the arsenic component which is used in the chemotherapy agent as well. Arsenic disulfide, right? All these things. So then, apart from that, the even diamond which is used in the brain cancer.
Diamond.
Yeah, the diamond in the dust form, which is the purified and which is converted into a nanoparticle and which has been used.
Wow, that I've never heard. And then that is expensive. How, where do you have suppliers that supply these things, like medical diamonds?
Yes, we have, and which is not a very rare medication, which is really used by many Ayurveda doctors.
Really? Only for brain cancers or for other things as well?
No, even to the extent of the ovarian cancer, then the uterus cancer and all those things which is used, and especially abdominal cancer, in the pelvic area, especially the ovarian cancer with diamond success rate is quite good.
And that is also like a 3 or 4 month therapy, like where you mix the diamond powder. So I'm just trying to imagine you are
No, it is
contacting your diamond supplier and getting diamond powder.
not the diamond powder. The diamond will go for a hardcore process, which becomes completely, absolutely the toxic free, and we need to test for the lot of the toxicity test. Then for the now modern parameters, it is being set like XRD, XRF machine. Then we need to do all those parameters. Once it is fit to be a medicine, we use it. And for a 1 month, believe me, it is for the 1 month the dosage is for 30 days.
No, say again, you cut off. Say again, you cut off. Just say it. It was the biggest moment. Oh, wait, Dr. Satish, you cut off again. Repeat again. This is
100
like...
mg 1 month, 30 days, we need to give just 100 mg of the diamond basma.
For 30 days, 100 mg of diamonds.
It needs to be spread across for the 30 days.
And how much would that cost, like for the patient?
Oh, that 100 mg will cost you around 2,500 to 3,000, not more than that.
What? 3,000? Which currency?
In Indian currency.
Okay, so translate that to dollars, just so I can... 3,000. I'm trying to remember how many zeros I have to remove.
Yeah. Okay, around $40.
Oh, okay, for the whole month, just $40. So that's not...
That is a one single component. Along with that, we need to do something else. So it goes on to that.
Yeah. And would the gold minerals added to the medicines, would they be subjected to gold prices going up and down?
See, at the time of when I'm preparing, definitely that cost becomes this thing. See, one is the original gold cost, and on the top of that, you need to prepare it. It is almost take the one appropriate gold basma in the classical way if you prepare, which will not less than 6 to 7 months. Then your labor cost, everything goes on. So at this level, I'll tell you.
speaking jewelry now.
So okay, again, 100 mg of gold bhasma will cost you around $30.
Okay, but you would need much more than that.
Yes, for a 1 month treatment, you will require. So around 1800 mg means around 2 grams you require, which comes around like easily, let me say.
40 times 10.
Yes, 1 second. So around $100 per month.
Okay, yeah. And when you say it takes a 6 to 7 month process to prepare the gold, is that removing the toxins that you said the diamonds might have as well?
Normally, in even in the classical test, it is very well explained. The gold is the toxic free, the metal. There is no toxicity in the gold as such. But we need to see the gold as such. One cannot drink or eat. It won't get assimilate in the body.
Yes.
We need to process where it get assimilate in the body. That process Karna or making a bhasma out of it. So that process classically, we need to first purify the metal, then we need to make it brittle, then we need to combine with the several other herbs and make into the pellets. Then you burn it under the lot of the we means classically which is kept means after the pellets, which is covered in like the mud lids, and that mud lid is entirely packed nicely. Then which is kept under the cow dung cakes, and the cow dung cakes with the help of cow dung cakes it has been burnt. So like that process has to be repeated till the the parameters which is explained in Ayurveda, that particular whether those medicines are well prepared or not, there are particular parameters. We need to do those tests. Till that time, we need to keep repeating the procedure.
Yeah,
so
in
that
order for it to assimilate into the body correctly.
Yes. So those minerals cannot be given in the similar form to any person. It is highly toxic. But if you make it to assimilate and this thing, definitely, which is this thing, that is where the bhasma particle, the any mineral bhasma particle in between the size of 2 nano nm to 5 nano nm. That is the finest, the fine quality which attains.
Are you saying basma with a B?
Yeah, you are right.
Basma means the medical form of the mineral.
Yes, absolutely.
Yes. So when you're giving minerals like gold, silver, or even arsenic, you're giving it to attack the cancer cells, right? Not to because you said it's similar to the arsenic being used in chemotherapy, so it is a killing element.
Yeah, I will tell you. In gold is given not to tackle the cancer directly cell, because even in Ayurveda they said the cancer patient they will mentally become weak. Second thing, the vitality of the whole body vitality goes down. To protect the vitality, to provide the absolute nutritional and the entire their dietary particular supplements, and to protect the vitality and prevent the cancer, the gold bhasma is required, not to treat the cancer.
Not to treat the cancer, to protect the vitality of the human receiving.
Yeah, the physical and mental
Yes.
to maintain the well-being, the gold bhasma is required. Whereas arsenic compound, then the certain particularly the metallic iron components, these things to directly attack on the cancer cells, we need medication.
Arsenic and iron is to attack.
Yes, and
silver.
Similarly, yeah, and also the diamond, which directly attack on the cancer cell.
So arsenic and iron and diamond attack, but silver and gold heal the person?
Yeah, absolutely. But in certain blood cancer varieties, silver also attack on the abnormal cells.
Okay. Silver attacks on the abdominal cells. So silver could work both. Could be both. Okay.
Yes.
Very, very interesting. So,
That is how,
Mm.
sorry to interrupt.
No,
So
go
that's how,
ahead.
yeah, that's how in India, the olden days, they used to serve the food in a silver glass, silver plates and all those things because that removes the toxic effect of the food.
Ah, really? But what about copper? They use copper a lot. Silverware,
In
like where.
copper, the copper articles are not used directly. The copper will have inside in coating. In that, they used to cook the food and not every variety of food. The food which is not sour in taste, like the lemon, buttermilk, these things are not cooked in the copper. Even that turns to be a toxic. It is very clearly said.
Because it will
Few
remove some of the copper into your body, yeah?
Yes. Yeah, so those things contraindicated in text itself. Only few varieties of cooking is meant to be doing it in copper.
But there's a lot of copper glasses and like drinking from copper. Is that not an Indian?
In Ayurveda doesn't advocate for everyone that. Only
Okay.
condition, but as you know, the mass kind of a mass hysteria, someone got better, the people will start to follow,
Yes.
which is not meant to be for everyone.
Yes. So the suppliers of the herbs and medicines in India, or even this type of gold and silver that you use for medications for cancer, are they only in India, or are we talking about worldwide suppliers as well?
In a certain part of the world, which is now they open their gateways for Ayurveda mineral product also, but still many parts are really means authentically for a chain of the commercial purpose, the gateways are not open in many countries. But as a person, the patient, if decided to take those medication, they are most welcome to carry. Most of the countries, no issues. But commercial purpose, only few countries are there. Their gateways are open.
Yeah. So you mean if somebody is carrying it and entering a different country, that's not a problem, but you can't source it in other countries.
Yes. They cannot sell it. If it is their personal use, nobody will.
Yes. I think I just very, very interesting. And I think we will end on this note. If you have anything in particular to add, a question that you feel I didn't ask, I don't want to go over an hour, and I want to wait also for questions from our viewers. Is there anything that you feel you wanted to add about cancer that I didn't ask you?
Majorly the abdominal cancer, we discussed about the pelvic, the pelvic organ cancer, especially abdominal cancer, the stomach cancer, the lower end of the esophagus, and specifically the liver cancer and all those things were dealt in a very nice way. Even there are few people with the fourth stage B grade, the liver cancer, very few people. About in my experience, I'm telling you. 3 to 4 people recovery was really quite good. Even they're alive, but that is kind of a I don't want to call it like it is like a miraculous recovery. I can't expect with everyone. So the liver cancer and all those things are really dealt in a very good way. Intestinal cancers, because certain Ayurveda medicines are there which directly stops the spread of cancer cells in the abdomen level. Yeah.
Including stomach cancer?
Yes, even in stomach cancer, the recovery rate is quite good, but whereas the throat and the esophagus, very difficult, even in Ayurveda. In my experience, not talking about others, but in my experience also, the throat and esophagus cancer is a bit difficult.
So liver cancer and stomach cancer for you is easier than throat and esophagus cancer?
I think it's much easier because the number of complications are very less. When it comes to esophagus and all those things, because the taking medicine itself becomes a problem because of the tumor cell, the tumor thing.
Yeah.
So that becomes a bit challenging. But whereas the stomach cancer and liver cancer, if they tackle in a very early stage, the outcome is really good.
So for these, I imagine you're using the anti-inflammatory processes, right? So the reducing inflammation and excess, like you said.
Correct. Even As I told you, when the stomach cancer are treated in a very, not even much of arsenic compound, with the basic stages of certain Ayurveda herbs, which is treated very well. Even liver cancer in the initial stage, certain hepatoprotective medications being given to the treatment of this thing. Not Ayurveda classical cancer medicine also not used in the very initial stage.
If it's an early stage cancer, you mean? Yeah.
Yes, yes.
And for liver cancer, do you use castor oil packs as well? Because I know they use that for liver problems in general, but liver cancer as well?
Yes, see the castor oil pack and all those things basically comes under the naturopathy heading. So we use a lot of herbal paste application. There is something called as sharapunka. There is Ayurveda herb, which is very potently used. The whole plant is been it is a shrub. We take the whole shrub and we make a paste and we apply it on the liver area as a pack, which really works very good.
And it works by going into through the skin and into the liver to remove cancer cells. How does it work? Like, does it detoxify?
Yeah, so when we put the lepa, the sharapunka is meant to be means which reduces the directly work on the reducing the cell size. So when we put up a particular pack on the particular area, so that particular herbal essence will absorb through the sebaceous gland and which goes to the systemic circulation. It get into the systemic circulation, and we need to keep it on for the 3 to 4 hours or 4 to 5 hours on that particular area, and repeatedly, not one day, the 21 days, 28 days, we keep on doing the same. We keep on repeating the same thing.
And do you access the liver through the colon as well, through enemas, oils in the enema, or no?
Yes, it is under the Panchkarma, particularly based on the symptomology. The vastis are herbal oil enema and decoction based enema is given. Even there also certain the anti-cancerous the decoctions can be made into and which can be pushed into the rectum. Those things. It all comes under the hospital management.
Yes.
It cannot be done at home. The person need to be hospitalized.
Yeah. Okay, so just to end, how would you recommend somebody as a cancer prevention? Would you say, because you mentioned Panchakarma is a 10-day process, if I'm not mistaken, a 10-day Ayurvedic treatment, is that correct?
Basically, as bare minimum 14 days.
Bare minimum 14 days. Okay, so it's my mistake. So, and that's treating the whole body as a whole is the Panchakarma, correct?
When somebody is undergoing panchakarma, it is a treating the whole body, the body, mind, everything need to be considered and we need to treat. But somebody is having their own particular health issue, those areas can be targeted. But again, when we do the treatment of panchakarma, the entire body will be treated. It is not, but we can target certain. There depend upon their sign and symptoms. Based on that, we can target those areas more. But when we do panchakarma, it is the whole body.
Yeah. So it would be a good place to start, at least with Ayurveda, to do prevention or health in general, to do 2 weeks of Panchakarma like once a year.
Absolutely. Even if the person is absolutely hale and healthy, but still the whatever toxic effect of the different varieties of the food, then the climatic change in the climatic condition, all these things, whatever free radicals get accumulated in the body, that can be really worked on very well. And that by doing Panchakarma treatment, their cell quality and cell health will improve.
Yes, yes. Dr. Satish, thank you so much. I have so many questions. I don't think I will ever finish, but we will keep them for other interviews. And I will put your details if somebody wants to book with you as prevention, or even if they need any cancer advice or cancer healing. I will put your details in the description, and hopefully you can meet some of my viewers at some point. So I really appreciate your time. Thank you very much.
Thank you. Thanks for the time.
Thank you, Dr. Satish.
Thank you.